This video will assess acromioclavicular joint play. First, our patient is seated in a way that we can do palpations. First, we will palpate the clavicle, or in layman's terms, the collarbone. We will follow the collarbone up to the top of the shoulder. We will then palpate for the acromion, which is the flat bone on top of the shoulder, and we will follow those until they come to a firm endpoint. You'll be able to know whenever you've reached that point because there's a little soft spot at the apex of the shoulder. Now the patient will lie supine to begin special test. Once the patient is supine, the clinician will take their thumbs and their index fingers and grasp on to the distal clavicle. Once the patient has grabbed a hold of the clavicle and palpated the AC joint to make sure they're in the right position, they'll then begin the acromioclavicular joint play special test in 4 different motions. First, grasping the clavicle, we will make an effort to pull up on that clavicle to check for hypermobility. We'll then reposition our hands so we can push down on the clavicle towards the abdomen. We will then push down on the clavicle like we're pushing it towards the back of the body. And then we will also reposition our fingers. That way we're able to pull that clavicle towards our neck to check for mobility of that AC joint. A positive test to the acromioclavicular joint play test would be pain or hypermobility at the AC joint. This could indicate an AC sprain, which is often caused by falling on an outstretched hand.